Welcome to Mount Sinai West Hospital. Thank you for choosing our institution to have your surgery. We are committed to making your hospital experience and recovery our top priority. This class is designed for patients undergoing total hip and knee replacement surgery. The goal of this educational class is to help you prepare for your upcoming surgery and to understand what to expect throughout your joint replacement journey.
Hello, I'm Jody Holmes, and I'm the nurse manager for the inpatient orthopedic surgery unit here at Mount Sinai West. On behalf of the treatment team, I would like to welcome you to Mount Sinai West and thank you for choosing our esteemed providers for your joint replacement surgery. Together with your interdisciplinary team, we will get you up and moving the same day of your surgery. You may be discharged on the day of your surgery, but if not, it's our goal to get you home by 12 p.m. on the next day. We're dedicated to providing you with exceptional service and a great inpatient experience. If you have any needs throughout your hospital stay, please reach out to me, Jody, or a member of your treatment team. We look forward to caring for you soon. Hi, welcome to 10A. This is the inpatient orthopedic surgery unit here at Mount Sinai West, where you'll recover from your orthopedic joint surgery. It's currently October, which is the reason for all of the Halloween decorations. But here on 10A, movement heals, and we look forward to seeing you soon.
Hi, I'm Kate.
And I'm Lindsay, and we're physician assistants with the orthopedic team.
And we're going to walk you through how to prepare and what to expect for your upcoming joint replacement at Mount Sinai West.
Welcome to our pre-op educational class. This class is designed for patients undergoing a joint replacement and are being discharged home the same day as surgery. Joint class is divided into two parts. During this video, you will hear from a few of our orthopedic unit staff members who will go through what to expect during your hospital stay. The video will highlight physical therapy education, social work education, and nutrition education. We also scheduled you for a one-on-one individual session with a provider. During this session, we will review your medical clearance, medical history, and answer any questions or concerns you may have. In preparation for your surgery, we ask you to stop the following 1 week prior to surgery: anti-inflammatory medications such as Advil, Meloxicam, Celebrex, or any NSAID, all vitamins, all herbal or natural supplements. Please refer to your primary care physician regarding all other medications. It is important to inform us if you are taking aspirin or any other blood thinners. If you are taking any of the following medications used for diabetes or weight loss, we ask that you stop them at least one dosing interval before surgery. We will review specific instructions with you during your individual meeting. You will obtain medical clearance from your primary care physician or cardiologist within 30 days of your surgery date. This clearance will include blood work, an EKG, chest x-ray if necessary, and a letter of medical clearance from your doctor. Please contact your surgeon's office to confirm your medical clearance was received. 5 days prior to surgery, as well as the day of surgery, please use HIPAA to wash the extremity that will be operated on. This is an antiseptic wash that will be used in the shower after you wash your body with regular soap. Apply 1.5 teaspoons on a washcloth and scrub the operative site. If you were not already given the wash by your surgeon's office, you may purchase this over the counter or arrange picking up the wash at your surgeon's office. Please refrain from using lotions or shaving the extremity 1 week before surgery. For at least 72 hours prior to surgery, do not smoke, drink alcohol, or use recreational drugs. These may interfere with the anesthesia medications. If you develop a cold, virus, sore throat, or other illness during the week before your scheduled surgery, please contact your surgeon's office. It will be determined whether your procedure should be rescheduled. What to bring the day of surgery. You should wear comfortable, loose clothing and supportive shoes or sneakers. Bring a government-issued photo ID, insurance card, and prescription card. A list of medications you are currently taking. A credit card for copays for discharge medications, durable medical equipment, and transportation. A cell phone and cell phone charger. A telephone number of the person escorting you home. On the day of surgery, do not wear contact lenses or body jewelry. You may wear eyeglasses, hearing aids, or dentures. However, these must be removed prior to surgery. Please bring your containers in which you store these items. Do not bring any valuables or jewelry. On the evening before surgery, you will receive a call to let you know the time to arrive for surgery. Please arrive at the patient entrance for ambulatory surgery, 428 West 59th Street, located next to the emergency department. These are the guidelines for eating and drinking before surgery. 8 hours before surgery, stop eating all solid foods, but you can continue to drink clear liquids. The morning of surgery, we strongly encourage you to drink 16 ounces of clear liquid before you leave for the hospital. This includes Gatorade, but no red color, black coffee or black tea, but no milk or creamer of any kind, and water. Your case may be canceled if you do not follow the above instructions. If you are taking medications for diabetes or weight loss, such as Ozempic or Mounjaro, please refer to the eating and drinking guidelines provided to you by your surgeon's office. During your individual meeting, the PA will discuss these guidelines with you in more depth. It is very important to arrive on time to the hospital. You will arrive at the ambulatory surgery entrance and be directed to the 5th floor. There are parking garages surrounding the hospital. There are 2 garages on 59th Street between 9th and 10th Avenue. After checking in, you will be taken to the pre-operative holding area. You will be greeted by the nursing staff, change into a gown, and have your vitals taken. Security will take your valuables to a safe location. You will have a hospital ID bracelet put on your wrist. For your safety, you will be asked to verify your name and date of birth multiple times on the day of surgery. We want to ensure you are the correct patient getting their correct procedure. What to expect the morning of surgery. You will meet a member of the orthopedic and anesthesia team. You will have time to discuss any questions or concerns. You will sign consent forms. Your operative site will be marked by your surgeon. The anesthesiologist will meet with you prior to your surgery to discuss your anesthesia and answer any questions you may have. An IV will be placed in your arm, which will allow medications to be given to you so that you are comfortable throughout the procedure. If you have had any experiences in the past with anesthesia, please inform the anesthesiologist. It is important that we have as much information as possible to provide the best anesthesia care to you. In the holding area, you will be given a one-time therapeutic dose of an iodine-based medication to get rid of MRSA or MSSA that lingers in the nose. If you have an allergy to iodine, you would have been prescribed Bactroban pre-operatively to apply in your nostrils twice a day for 5 days before surgery. After surgery, you will be taken to the PACU, or the post-anesthesia care unit, a unit where you will be closely monitored. You will notice a bandage and ice pack on the operative site. You will be evaluated by a physical therapist in this area. You will be asked to rate the severity of pain using a pain scale. There is no right or wrong answer. Just rate your pain as best you can to give us an idea of how close we are to making you comfortable. Ice packs will be placed to help with pain and decrease inflammation. Always tell your doctor, nurse, or other staff member when you are having pain. Methods to assist with pain relief include relaxation techniques, rest, deep breathing exercises, and proper positioning in bed. A few hours after surgery, your therapist will see you in the recovery room and prepare you to go home. Physical therapy will review with you the exercises you should continue at home. If you have stairs at home, your therapist will practice stairs with you prior to discharge. A social worker will be assigned to your case after surgery. Social work will send a referral to an accepting home care agency. You can expect a call from your home care agency 24 to 48 hours after discharge to set up a time to begin home physical therapy. Home physical therapy will continue for approximately 2 weeks. Some patients may be suited for outpatient therapy immediately following discharge if cleared by the surgeon's team. So how do we prevent blood clots after surgery? The most important way to prevent blood clots is to walk every day. You will be discharged on an oral anticoagulant to keep your blood thin to prevent clots from forming. This medication will be prescribed to your pharmacy. Most commonly, you will be given aspirin. Other examples include Xarelto or Eliquis. Sequential compression devices will be placed on your lower legs while you are in bed. They inflate and deflate periodically to improve blood flow. Antibiotics will be given to you through your IV during surgery as a preventative measure. If you have diabetes, it is important to keep your blood sugar under control. If you are undergoing a knee replacement, it is extremely important to prevent joint stiffness. We have a few weeks to get this joint moving. We want you to begin bending and straightening your knee immediately after surgery. This will be done initially under the guidance of the physical therapist. You will need to do this on your own upon discharge multiple times a day. What to expect upon discharge? It is necessary to have someone accompany you home the day of surgery. Your medications will be sent to your pharmacy prior to surgery. These will include pain medication, blood thinner such as aspirin, stool softener, and any other medications determined by your surgeon. You may receive durable medical equipment or prescriptions for them. This will be discussed prior to discharge if you need any additional equipment to aid in your recovery at home. You will receive from the nursing staff and orthopedic team detailed instructions for continuation of your medications, wound care, exercises, and follow-up care. We also offer flu and pneumococcal vaccinations. You will be discharged home with a walker. We recommend patients getting a hip kit prior to surgery to aid in recovery at home. This kit includes a sock aid, dressing stick, reacher, shoehorn, and elastic shoelaces. Please check with your insurance regarding coverage. After you are discharged home from the hospital, you will receive a call from the orthopedic team the next day checking in on your home recovery. Make sure to call your orthopedic surgeon to make a follow-up appointment a few weeks after surgery. Continue taking the oral anticoagulant prescribed. Continue doing your home exercises advised by your therapist. If you have any concerns while at home, please call your doctor's office or home care agency. For an emergency, call 911. Our hope is for you to continue living a healthy lifestyle. Continue to exercise and walk daily. Maintain a healthy weight. Be mindful of your daily nutrition. If you haven't done so already, we strongly encourage smoking cessation. Our goal is for you to have a safe and positive experience while at Mount Sinai West Hospital. We encourage you to push yourself as much as you can. We'll give you all the tools and assistance while you are with us to make your orthopedic surgery a huge success. Please remember to walk every day.
Hi everybody, my name's Greg. I'm one of the orthopedic physician assistants here at Mount Sinai West. Right now, we're in the holding area. This is the area where you'll be directed to shortly after you check in. While you're here, you're going to be meeting a lot of different people, from medical billers who will be reviewing your demographic information as well as your insurance information, from our nurses who will be reviewing your medical history, from the surgical team and the surgeon who will be going over your operative plan, and with the anesthesiology team who will be going over how they will be keeping you safe and keeping you comfortable during your surgery. Many of the questions that we ask do happen to overlap. We apologize for this, but there is certain information that we have to hear directly from you. We also ask that you may have to fill out a short survey if one has not already been done at your surgeon's office. We look forward to seeing you, and thank you very much for choosing Mount Sinai West for your surgery. Have a great day.
Hi there, my name is Jason Lee, and I'm an anesthesiologist at Mount Sinai West, and I'm also the Director of Quality Assurance for the Department of Anesthesiology. Today, I just wanted to give you a brief overview of what to expect when you come for your surgery for your total joint replacement. When you first come to the hospital, you'll meet the nurses who will do your intake and get changed. As you approach closer to your surgery time, you're going to meet members of the anesthesia team who will go through the process of getting you ready for the surgery and telling you more about the anesthesia experience. First, your anesthesiologist will sit down with you and discuss your medical history and review all the information that was obtained from your primary care physicians and the various specialists that you see on a regular basis. This includes any documentation about your past medical history, your labs, and any special tests that were performed to make sure that you're fully ready to undergo anesthesia and have your procedure done. After your history has been reviewed, your anesthesiologist will then review your two options in terms of the anesthesia that we can provide you. Our two options that we provide at Mount Sinai West consist of neuraxial anesthesia, otherwise called spinal anesthesia, or general anesthesia. Your surgeon and anesthesiologist will likely suggest that you undergo spinal anesthesia. This is a small procedure that's performed in the operating room before the surgery starts. After an IV is placed, you will receive a little sedation through the IV, and a small injection will be performed in your lower back. After the injection is done, you'll start feeling numbness from your belly button down to your toes, and a small infusion of sleeping medication will start so that you sleep through the rest of the surgery. Spinal anesthesia will make sure that you feel no pain, and it will wear off about 30 minutes to an hour after the surgery is done. The alternative to spinal anesthesia is general anesthesia, which is always our backup if there are any issues with spinal anesthesia. General anesthesia consists of IV medication given to you to get you fully off to sleep. You will be so asleep and so comfortable that your anesthesiologist will perform a small procedure to protect your lungs and make sure that you're breathing well, called intubation. At the end of the procedure, you will wake up without the breathing tube, and you will be nice and comfortable, ready to go to the recovery area. Your anesthesiologist may also consent you for what's called a peripheral nerve block. This is a small ultrasound-guided procedure performed to provide some extra pain relief on top of the oral pain medications that you may take. This injection won't take away all the pain, but it will significantly reduce the amount of pain you may have and the amount of medications you may need to take during the first 12 hours after the surgery. Our team is passionate about providing quality anesthesia care, and we look forward to meeting you on your big day. Thank you very much.
Hi there, my name is Michał Sokolowski. I'm a senior physical therapist on orthopedics, and this is some of our team that you might be seeing while you're recovering from your surgery.
Hi, my name is Lloyd. I'm a physical therapist.
My name is Casey. I'm also a physical therapist.
My name is Shannon. I'm also a physical therapist.
My name is Dorothy, also a physical therapist.
My name is Kathleen. I'm a senior occupational therapist.
My name is Nicole. I'm also an occupational therapist.
My name is Jackie. I'm also an occupational therapist.
So my name is Casey. I'm from physical therapy, and I'm going to be going over the rehab after you have your total joint replacement. The rehab team can include training by physical therapy, occupational therapy, and/or the orthopedic physician assistants. The team will see you in the recovery room 1 to 3 hours after you arrive out of the OR and as needed throughout your stay until you're discharged. Rehab in the recovery room will consist of transferring in and out of bed, walking with a rolling walker, going up and down stairs if that's necessary to go home, going over exercises lying in the bed and at the edge of the bed. And the team will discuss any equipment needs and provide equipment at bedside as necessary for discharge. So the rehab goals is to get yourself in and out of bed safely, walk safely with an assistive device, go up and down stairs if necessary, know your basic home exercises, being aware of what movements are encouraged as well as what movements, if any, should be avoided. In your binder, there are exercise handouts that you can look at and review before you have surgery. These exercises can be performed 3 times a day while in the hospital. The physical and occupational therapy will go over them with you. 2 exercises that you can do that are listed on this slide. On the left-hand side are what are called long arc quads. You can perform this exercise sitting up in a chair where you extend your surgical leg and then bend it back to the ground. And the exercise on the right are called ankle pumps, where you can lift your toes up towards the ceiling and then your heels towards the ceiling.
So my name is Jacqueline Anderson, and I'll be discussing the durable medical equipment. So for durable medical equipment, you may need a walker, cane, commode, tub transfer bench, or tools for dressing. Some of these equipment items may be covered by your insurance. Other equipment may require co-payment or full purchase. We do provide in-house vendors for some of these equipment items. Other items may be purchased from your local surgical supply store or online vendors like Amazon. For home safety at discharge, please have someone to accompany you in the home. Have a pair of loose rubber soled shoes to wear in the home. For furniture, have firm chairs with armrest. You can add pillows to low couches and chairs if necessary. Clear clutter and throw away rugs. Be mindful of pets. Be careful when walking on different surfaces. Safety in the kitchen, prepare meals ahead of time or plan for meal and grocery delivery. Organize kitchen to have items easily in reach. Safety in the bedroom, tape down or remove cords from walkways. Have clear pathways in and out of the bedroom and reorganize clothes to make them easier to reach. For safety in the bathroom, organize the shelves prior to surgery, making sure all frequently used items are easily accessible. Make sure the bathroom doorway has clear access. Your patient responsibility is to do your best when PT or OT comes to see you. Try to perform your exercises at least 3 times throughout the day once you go home. We want your surgery to be successful and the recovery process to go smooth as possible. Thank you for coming.
Hi there, my name is Michał Sokolowski. I'm a senior physical therapist here at Mount Sinai West. So after your total joint replacement surgery, the best thing you can do is to ambulate, change positions throughout the day as much as possible. The worst thing you can do is stay in one position in bed all day. It puts you at risk of a lot of complications. So taking little walks to the kitchen, to the bathroom, doing as much on your own as possible is the most important. In your discharge paperwork, you will get a set of basic exercises to do at home. You will also go over them in your joint class. I suggest that you go through them already so you're comfortable doing them at home before you even have the surgery. It's a lot easier to tap into that muscle memory to do the exercises than to learn a new exercise when you arrive in the hospital. So the first exercise is very simple. It's called a quad set. For all these exercises, the frequency is listed on the handout. It's 3 sets of 10, 3 times a day. So we're shooting for about 90 repetitions per day. Especially after a knee replacement, you might want to space those exercises more frequently. So maybe a set of 10 every hour just to keep that knee nice and loose. So the first one, you're going to work on knee extension in bed, laying flat. So you're going to press straight down into the bed, contract the quadriceps muscle, maintain that contraction for 5 seconds, and then just relax it. And that counts as 1 repetition. So we're shooting for 10 of those. Very simple exercise, just gets that knee into full extension in supine. The second exercise, now we're focusing on knee flexion. So you're going to slide your heel towards you as far as you can. There you go. Cat has beautiful range of motion. You will not have that range of motion after surgery, but we are aiming to stretch that knee. So you can extend it back down, slide it back. This might be difficult after surgery just because of pain and swelling. Still very important to push through that pain and swelling to get that new range of motion. So what you can do is you can use your hands on your thigh to help pull that leg towards you to get more of that stretch. Or an alternate method is you can, if you have a strap at home, you can use a strap. If you don't, a rolled up sheet works just fine. You can hook that sheet under your foot and just use your hands to pull that leg towards you. Perfect. All right. Perfect. The next exercise is called a straight leg raise, SLR for short. So you can bend the opposite leg just to relieve some pressure on your back. And then you want to raise your leg straight up. And again, cat has great flexibility. You can go to about the height of the knee on the other hand, and that will be great. That's a very difficult exercise to do after a knee replacement. Should be a little bit easier after a hip replacement, but still a challenge. Again, you can use that rolled up sheet to help pull it up. Perfect. The next one is a terminal knee extension. So you can have a rolled up sheet or a rolled up pillow underneath that knee. Right? So you see how that knee now is in a little bit of flexion. Here, a note of caution. This position does feel great after a knee replacement. Do not leave that pillow under the knee. You want that knee nice and straight when it's in bed, and the physical therapist here will definitely stress that when they see you. But for the exercise, you're just straightening the knee. There you go. Nice and slow, and then back down. Perfect. Okay. The most basic exercise after a surgery, it helps prevent blood clots and diminish swelling. It's called ankle pumps. This you can do on both legs, just full plantar flexion, dorsiflexion. So moving your ankles up and down, nice and slow. And those you can do if you're watching TV, every commercial break. Again, the recommendation in the handout is 3 sets of 10, 3 times a day. But these I highly recommend that you do more frequently throughout the day. And you can do those laying down or sitting up. Okay, and the final one, you can sit up. Again, this exercise is predominantly for knee replacement patients, but you can do those after a hip replacement as well. We're going to work on that knee extension and flexion again. So this is for extension. Nice and slow. Try to not rely on the momentum. And again, after a knee replacement, this exercise will be very difficult to complete. And you can modify it with either a strap or a rolled up sheet, just to again stretch that knee, make sure that that scar tissue is not forming in a way that it restricts your range of motion. Very nice. So that's for extension. If you scoot forward, then you can focus on flexion and sliding that heel under you, forward and back as far as you can. And again, Kat has full range of motion, so this is a lot easier for her than somebody after a total joint replacement. And you can use the other leg to actually push the leg forward and back as well. It's a lot easier if you have some back support for that one, for the modification. Again, the physical therapist will go over all these exercises with you when you're here after your surgery, and if you have any questions about them still, make sure to ask either a PT or an OT.
Hi, I'm Stephanie Flam, and I'm an inpatient social worker at Mount Sinai West. A social worker will contact you prior to surgery to assess your existing functional needs and resources and to discuss the discharge plan anticipated for you following your surgery. If you have concerns about managing at home following discharge, you can discuss them with your social worker prior to surgery. The social worker will collaborate with your doctors and therapists to formulate and educate a personalized discharge plan on the day of your surgery. There are daily rounds where your team will meet to discuss your progress, needs, and concerns. Once we have formulated a discharge plan, a social worker will facilitate any recommended services for discharge. If you are recommended for home care services upon discharge, including home PT, nursing, or occupational therapy, a social worker will assist in arranging these services. You will be provided a list of certified home health agencies, and a social worker will refer you to an agency that is both in your area and in network with your insurance. Once your case is accepted and confirmed by the agency, you will receive a call from that agency to initiate care once you are discharged. Home care services usually begin within 24 to 48 hours of discharge whenever possible. Contact information for your home care agency will be available in your discharge paperwork should there be any issues following discharge. Depending on insurance coverage, a physical therapist will come to your home between 3 and 5 days a week. Complete duration of therapy is between 1 and 3 weeks post-surgery. Most patients have 2 weeks of in-home therapy. The goal of intensive therapy is to get you back to your normal life in your home faster. The following are not usually covered by your insurance, although we are able to arrange these services if needed. Transportation from hospital to home, in some instances transportation to rehab center, private nursing home attendant care, some durable medical equipment. Each insurance plan is different, and we are happy to explore your individual plan's allowances with you post-surgery. And finally, we want you to get back quickly, safely, and comfortably to your new old self. We are here to help. Please feel free to contact the social worker before, during, or after your admission if you have any questions regarding the discharge plan.
Hi, my name is Elise. I'm one of the dietitians here at Mount Sinai West, and I'm going to be talking to you a little bit about some strategies to optimize your nutrition both before and after your surgery to get you back on your feet as soon as possible. So first we're going to talk about some strategies to get your body ready for the surgery from a nutrition perspective. It's going to be really important that we are fueling your body properly to prep in advance of the stress that the procedure is going to put on your body. It's going to be important to include protein 1 to 2 weeks before your surgery, making sure that you are including a protein at every meal and snack. So that can be from an animal source such as meat, eggs, chicken, poultry, fish, or it can also come from our plant-based sources such as tofu, nuts and seeds, as well as beans. It's really important to include protein because protein does provide building blocks for muscles, bones, and it does also strengthen your immune system by promoting the production of antibodies. Protein is going to allow you to be as strong as possible going into surgery. We do also want to make sure that you are stocking up on your fruits and vegetables prior to surgery. Our fruits and vegetables are a great source of various vitamins and minerals, including vitamin C, vitamin K, iron, and magnesium that are all going to be helpful both prior to and following your surgery. And vegetables and fruits also help to support a healthy immune system, promote regular blood sugar levels, and reduce overall inflammation. Typically, the darker the vegetable or fruit, the more nutrient dense it's going to be. Another thing that's going to be really important pre-operatively is going to be adequate hydration. Studies have shown that patients who are well hydrated prior to their procedure report overall less pain and nausea following the surgery. So we want to make sure that you're drinking at least 8 8-ounce glasses of water per day. And we do want to try to limit our consumption of foods that are going to cause increased stress on the body, such as sugar, alcohol, and caffeine. It's not to say that you can't have any, but we do want to make sure that we are trying to limit any excess stress and inflammation that can be put on the body prior to your procedure. This is also very important for our diabetic patients. We want to make sure that you're reducing any intake of sugar-sweetened beverages and excess sugar intake to help promote blood sugar control and reduce the risk of inflammation, infection, and increased wound healing following your procedure. So after your procedure, we want to make sure that we are fueling your body to get you back on your feet as quickly as you can. Nutrition is going to be a really important part of that. So again, we're going to talk about some components that can help you get on your feet as quickly as possible. Protein, once again, is going to be really important. As we discussed, it promotes wound healing. It also helps to repair the damaged body tissues and keep your immune system strong. And it's going to come from those sources that we previously discussed, both animal and plant-based proteins. Vitamin C is also really important in the post-operative stage as it helps to heal wounds as well as form collagen in bone, muscle, and skin. You can find this in a variety of fruits and vegetables, but primarily vitamin C is going to be found in those citrus fruits as well as strawberries, kiwi, potatoes, peppers, broccoli, and kale. One of the most common complications following surgery can be decreased appetite. It's very common in the post-operative phase, but that does not mean that our body does not need increased calories and protein. As a result, we want to make sure that if you are finding it difficult to eat your baseline portions of food, that we are utilizing some strategies to help combat that. Transitioning from 3 big meals a day to 5 to 6 small meals a day can be a strategy to help increase your overall intake of calories and protein. And including high-calorie, low-volume foods such as avocado, olive oil, dairy products, and nuts and seeds can also be very helpful when trying to increase your overall calorie and protein intake and pack a punch in each bite that you're eating. Another strategy to help combat decreased appetite is to drink your calories. So that can either be from a smoothie made at home that includes maybe your favorite nut butter, a fruit, vegetable, protein powder, as well as your milk of choice. And you can also find this in your pre-made nutrition drinks that you can find at a local drugstore, such as Ensure or Boost. Another strategy that can be helpful is working with a dietitian, both or either in or out of the hospital, on some ways that you can optimize your nutrition post-operatively. Constipation is another concern that comes up in the post-operative phase as a result of decreased movement and some of the pain medications, which are known to be constipating. In order to combat that, we want to make sure that you continue to stay adequately hydrated, drinking at least 2 liters of fluid a day, and we also want to make sure that you're including those high-fiber foods at each meal. So that would come from your fruits, your vegetables, and your whole grains, which will also help to get you your vitamin and mineral requirements. Fiber, especially our insoluble fiber found in our nuts and seeds, as well as fruits with the skin on and our leafy greens, are going to be really helpful for maintaining normal bowel function. So those are some of the things we're going to want to include on a daily basis. And this is just highlighting a lot of the topics that we had discussed. We want to make sure that, again, you are staying adequately hydrated prior to your procedure and that you're making sure that you're including a lot of fruits and vegetables that have both that fiber, vitamin, and mineral component to them. We want to make sure that you are eating enough in the post-operative phase and meeting those increased calorie and protein needs through smaller, more frequent meals as well as protein-packed snacks. We do also want to make sure you're avoiding any excess stress on the body by continuing to limit our consumption of excess sugar, processed foods, and alcohol. And if you do find that you have any questions or you're concerned that your appetite has remained low in the post-operative phase, feel free to reach out to a dietitian to help. Thank you.
We would like to thank you for trusting us to provide you with excellent care. We hope you feel more confident and prepared for your journey ahead. The second part of the pre-op educational class will consist of an individual meeting with an orthopedic physician assistant. We will answer all of your questions at this time. Thank you for choosing Mount Sinai West for your care.